All right, you ready for some LASIK? Because here comes Chrissy. The eyes have it.
The eyes have, yeah, you know, when they go fast. If you're ready for LASIK, now what? Dr. Heaton Lacani is here to help you choose the right LASIK surgeon.
Hello.
Hey, buddy.
How are you? Good to
Hey,
see you
you
again.
getting all ready for Thanksgiving tomorrow?
I am indeed. I have family coming in from New York, so
you?
we're gonna entertain a lot of people. Here.
Oh, how many people? Are you having dinner at your house?
At our house, yeah.
Oh, really? How many people are coming over?
We're having my brother and his wife and their kids, and then my sister and her husband, and then their family. So at least another 10 people or so.
Oh.
10, 50, yeah. So a good number of crowd.
Here comes the party.
That's right.
Okay, well, let's get down to business because we're talking LASIK surgery, which is what you do.
We're specialized, correct.
Well, and Joe and I were just talking about coming to see you because I'm thinking my 32-year stint with better than perfect vision has come to an end.
Okay.
And Joe needs to have some stuff done too.
Yes.
So we want to come. We want to come to you because we know you. But what about people who don't know you? How do they pick an eye surgeon?
Yeah, it's a good question. There are a lot of surgeons in town. They're mostly very, very excellent at what they do. And the way to think about it, really, as people go into a practice, they first look at the environment, they look at the people they meet, they look at the staff, and you want to make sure that the people are happy. But the next step is to really decide what surgeon to choose. And, you know, many of us have done the education, and I think the key things to look at are several things. Education, expertise, and then the person you meet, the caring attitude, whether you even are able to meet a surgeon.
Well, how do you even become a LASIK surgeon? Because it seems to me like an eye surgeon, you all have your medical degrees and you all have your... Do you have to have another degree? Do you have to have certification? How does that work?
You definitely go through your medical degree, and then you have to go through residency in ophthalmology, which is a general surgery of the eye.
Okay.
And then, not a lot of us, but it's more important that people do a fellowship, which is a specialty education year or 2 years, specific in cornea and refractive surgery, so specific in LASIK surgery. And there you do in university programs and whatnot. So that's an additional 1 or 2 years. And that, I think, is very important to do.
Is that a full-time 1 to 2 year program?
Full-time 1 to 2 program.
No, like you got your own practice, you do it at night? No, it is all day, all night.
All day. And you're doing surgery during that time, but you're being trained by others that have been doing this for some time. So I did my fellowship here at UCSD with David Shanson and had an excellent surgical fellowship there.
So how many years have you gone to school?
Well, if you count the 12 years normal, including college, and then you do another 4 years of medical school, and then 3 years of residency.
Now, hold on, wait. You have your 12 years of like through high school.
Through high school.
Then 4 years undergrad. Then
4 years undergrad,
and
correct.
then 4 years of...
And then 4 years of medical school.
Okay.
And then 3 to 4 years of residency, and then another year or 2 years of fellowship training.
Okay, I lost you. How many?
So
pretty much most of your life, right?
A lot of your life. So at least 20 years. Yeah.
Well, you know, academia is I call it a very humbling thing. I always take classes too, and I'm always working towards this or working toward that, and it's kind of you have to if you're gonna.
You have to.
You're gonna be at your level. You have to.
Yeah. And the thing, what they do now, when you're trying to get board certification, you have to keep up to date with medical experience by reading and going through conferences and stuff like that. So that's all very important, and that's why when you look at a surgeon, you have to make sure they're board certified with the Medical Board of California or the state that they're in. Make sure that they are part of organizations like the American Board of Ophthalmology, things that look at their criteria to make sure that they're up to standard with proper care.
Well, walk me through how it works. Let's say somebody comes, they're shopping for the right eye surgeon.
Right.
And can they come in and can they meet you or can they have a consultation? How does that work?
They can. And then I think that's another important criteria is that when you come in that you're actually meeting the surgeon's actually doing your exam, or at least you have the ability to talk to a surgeon. So in our practice, when you come in, you meet the staff initially, they do the initial testing and things like that, and then you'll meet either the surgeon or the optometrist, but you always have the opportunity to meet the surgeon. We go through the full exam. I do a full exam on every single person.
Oh, really?
I make sure that they are perfect in terms of candidacy, and then you sit down and chat with the surgeon about his qualifications, his confidence, and confidence I think is a huge thing, and that's important in terms of the volume that he's done and the expertise he has within the field.
How long should I take to put in my calendar for that consultation? Are we talking like an hour?
That usually takes about an hour to about 2 hours.
Oh, really?
Because part of that, when we do a complete exam, we do a dilated exam. And so part of the dilation, it takes about 20 minutes for that to occur. So, and you want to spend time with the patient and make sure that what they're looking for is what we can give them.
So, when you get dilated, does that mean you have to, when you're done, put those big sunglasses on?
The sunglasses on, correct. The dilation makes your pupils large so that the sunlight makes it a little tough, and whatnot.
Can you drive? You have to have somebody to drive you to do that, though?
Not for the exam, because usually dilation mostly affects your near work, doesn't affect your distance work for the majority of people. And so as long as you have sunglasses, you're okay. But on the day of the surgery, though, you need someone to drive you home.
Okay.
Because you're going to have medicine on board to help relax you.
Oh yeah. What did I call it last time? I said a margarita.
That's right. That's right.
Not really margarita. That's just my own take on it. Global Laser Vision of Friars Road, 1-800-GET-LASIK or 800-438-5274 or globallaservision.com. Thank you for coming in. Or
Thank
you can
you
go
so much.
You can go to fox6.com, you know. Also, don't go away.